I'm Captain Dan Collins with the Delaware National Guard 31st Civil Support Team, and we are currently supporting the Delaware Public Health Lab with their COVID-19 response. We're doing that in a few different ways. We're transporting samples from the hospitals up and down the state, and we're also providing support within the lab itself with sample processing and testing. We were directly requested by the State Public Health Lab. That request was then validated through DEMA and then the Delaware National Guard chain of command. Well, there are some pacing items within the lab, specifically processing of samples, doing the RNA extraction from the swab samples that are coming in, and we're helping to speed up that process by getting the samples to the lab faster. We're specifically focusing exclusively on transporting the COVID-19 samples, which allows the lab's standard couriers, their routine couriers, to focus on other types of samples, STIs, et cetera. We can get the samples from the hospitals to the lab faster, which allows them to begin processing and then testing at the lab. So we have CST personnel inside the lab helping with sample processing, QCing forms, making sure all the data is right, the paper trail, chain of custody is squared away, and then assisting with the actual extraction of the RNA from the COVID-19 suspected samples. The 31st CST has a really strong, productive relationship with the State Public Health Lab. They're right down the road from us here in Smyrna. We go to a lot of meetings together. We interface with them at the Laboratory Preparedness Advisory Committee meetings quarterly, and we're constantly talking back and forth about our capabilities and ways that we can cooperate in times such as this. So it's really been a great partnership, and we're happy that we can help them out. So even though coronavirus is a highly infectious virus, we're taking lots of precautions from our PPE and our going through and practicing our emergency procedures for the couriers, and also adhering to all of the protocols within the State Public Health Lab that they have in place to keep us safe. So really, with all those controls in place, the risk level is pretty low. Based on the guidance from based on current guidance on social distancing, the State Public Health Lab has had to compartmentalize its workforce into 2 alternating shifts. So that means they're operating at a much lower level with skeleton crew, and that's where we come in, because we can help them continue to process samples and process those samples efficiently without decreasing their overall capability. Based on current guidance on social distancing, the State Public Health Lab has had to reduce its workforce into 2 alternating 7-day shifts. So basically they're operating at a decreased manning level, a skeleton crew, and that's where we come in, because we can help them to continue processing samples, and they don't have to decrease their capacity for testing. They can still work efficiently, and we're able to plug some of those holes based on the relationship we have with them and how we worked together in the past.
I am Taiwan Brookes, First Lieutenant out of the 31st Civil Support Team, and we are helping the state of Delaware with flattening the curve of the COVID-19 pandemic by helping the Delaware Public Health Labs with receiving samples at a faster rate from all of the hospitals throughout the state. We begin our day by loading up our trucks with coolers to help keep the samples cool throughout the day, and then we go out to the northern hospitals and the southern hospitals to collect their samples and bring it back to Delaware Public Health Laboratory. Us collecting these samples and getting it to the lab helps the process in making it faster for the lab to begin testing each kit. The potential risk for our team to contract the virus while we are helping out the Delaware Public Health Labs is very low, and we are taking every precaution we can to maintain that. The Delaware Public Health Lab couriers have been training us on their process of navigating through the northern, central, and southern parts of Delaware. Their training has prepared us to fluently interject ourselves into their process and relieve them of many miles and many hours of driving. The 31st CST also has individuals inside of the lab going through the coronavirus samples and preparing them to get tested to find out whether or not the sample is positive for the virus or negative. That way, they are able to test more samples throughout one day, each day, and it helps us get better, more accurate information for the state of Delaware to know where we're at with this pandemic. I would like our friends and family to know that your National Guardsmen are always ready and always there.
Staff Sergeant Paul Romer, 31st Civil Support Team. Over the past couple of days, we received training courtesy of the Delaware Public Health Labs with their courier service in terms of transporting COVID-19 samples up and down the state of Delaware to support the state's reaction to the COVID-19 pandemic. It feels good to be out there within the community to assist our community with what we're dealing with this COVID-19 pandemic. So it feels really good to be out there and actively assisting with the mission. The easiest thing I can say to Delawareans out there is we're doing everything we possibly can to see that this situation resolved as quickly as possible in terms of getting everybody tested, so our leadership up and down the state and across the nation have a clear picture as to what's going on at the boots level right here in Delaware. The training we've received the last couple of days with public health actually has coincided very well with what we do pretty much as a civil support team. So it's in the name Civil Support Team. We're out there. We are assisting our civilian counterparts within this crisis to make sure that our community and the state of Delaware is well handled for. I feel really good. It's it's what you sign up for as a soldier, and more importantly as a Delaware National Guard soldier, to actually be out there and assisting our neighbors left and to the right of us. If there's one thing I can say it's a community struggle, it's what we've been facing the last couple weeks.